They help care for people who can't care for themselves. But now, thousands of home health care aides say they need help saving their livelihoods.
Ohio Governor John Kasich wants to end the state's use of independent contractors who provide home health services. Local 12's Jeff Hirsch shows us how some of those workers and the families they serve say the governor's idea is a bad one.
Hey, girlie.
Angelica Halcomb is 23 years old, going on life as a toddler at best.
She functions at probably a year and a half, if that.
Angelica was born with brain damage and has a variety of other neurological illnesses. She cannot speak.
She's basically in a wheelchair and requires 100% care 24/7.
One of Angelica's caregivers is Shelley Schmidt, an independent nurse who works directly for clients like the Halcombs rather than working for an agency.
She's not just a number. She's not one of many patients for me. She's one of a few. And she's going to always get better care from me than she is from someone who comes in today and may never come back to this home.
But Governor John Kasich wants to eliminate the independent service provider option. In his budget proposal, Kasich says going only through agencies would fight Medicaid fraud and abuse, saving taxpayer dollars and improving health care. To Shelley Schmidt, those arguments are an insult.
This is my livelihood. This is my nursing license. This is everything to me. And so I'm obviously going to provide the best care for that patient.
Schmidt says independent providers are actually less costly, and Angelica's father says there's something else.
I have the control now, and we're able to bring quality nurses in to take care of our daughter.
Of course, Angelica is not aware of the state of Ohio's budget, but there are 16,000 other in-home patients in Ohio cared for by 13,000 independent providers. Big numbers, but it really comes down to one nurse and one patient at a time.
I love my patients from the day I walk in the door. Hi, Dada. Hi, girl.
Now, this is a budget issue because government Medicaid dollars pay for home health care, independent or agency. Governor Kasich's plan would stop new independent providers from joining the system as of July 2016 and cut out all existing independents by July 2019. If you're saying, well, I've heard something like this before, well, you have. Last year, I reported on how thousands of independent home health care providers received late paychecks after a switch in the state's payment procedure. Now, of course, they might receive no paychecks. Back to you.
So what would these parents do? What would be available to them under the budget proposed by the governor?
Under the proposal, under this phase-out, they would have to go through an agency. And you hire from an agency, and I'm sure there's a lot of agency people out there who will disagree with this and say their care is wonderful. But you would have to go through an agency, and whatever, there's a lot of them out there, and they would staff you, and they could conceivably provide you one person that stays forever or a series of rotating people. But the agency, would assign somebody, whereas an independent health care person is hired by the parent who can say, I want you, I don't want you.
So it takes the choice away.
That's what the dad said, yeah.
Right. All right, Jeff, thanks very much. The state legislature has final say on the governor's proposed budget. There are Facebook groups of independent providers as well as a petition drive urging the legislature to reject the governor's plan. If you'd like to check those out, we have links at local12.com and on our Facebook page for you.